The purpose of this video is to demonstrate the correct procedure for requesting and reconstituting prothrombin complex concentrate, also known as PCC, from Blood Bank University Hospital Limerick. This video is to be used as an educational tool in conjunction with the procedure and in addition to attendance at the mandatory hemavigilance education. All hemavigilance procedures can be found on QPOL's documentation service. Please enter the search word hemovigilance and scroll down for the required procedure. PCC is a blood product issued from the blood transfusion laboratory or blood bank for the urgent reversal of warfarin and direct oral anticoagulants such as rivaroxaban and apixaban when certain criteria are met. If a patient under your care requires this product, it must be administered immediately to ensure optimum efficiency. PCC should only be given following discussion with a hematology consultant or registrar. However, an exception is made for patients with acute intracranial hemorrhage presenting to ED and AMU-UHL, for which hematology consultant approval is not required in order to minimise the risk of delays in administering PCC for suspect intracranial hemorrhages. For patients on warfarin, an INR should be checked before administering PCC, provided this does not result in delay in the management of potentially life-threatening hemorrhages. The requesting team must complete the Blood Bank 1 request form recording the patient's weight or estimated weight, the dose required based on 25 IU per kg up to a maximum of 3000 IU, and the current INR if it is available. A group and screen sample is not required. The requesting team must prescribe the PCC in the record of transfusion. On issuing, you can scan out the PCC from the kiosk in Blood Bank and complete batch kiosk collection checks as per procedure. On return to the clinical area, perform pre-administration bedside checks at the patient's bedside. The PDA can be used on all products, including PCC, to capture the transfusion and pre-administration checks and traceability. Please use the PDA in transfuse, pre-administration checks mode and generate a begin label. On completion of that, please reconstitute prothrombin complex concentrate using aseptic technique on a flat, firm surface. Open the box and set up. Product information leaflet comes in the pack, so please read the same and follow the instructions on how to administer and reconstitute. Open the caps using, as I said, aseptic technique, ensuring not to touch, and use an alcohol wipe to clean the top to clear away any residue that may have formed. So follow the instructions in the pack. Open the valve and attach the blue valve onto the water vial. You'll hear it click. Once it clicks, remove the packaging and turn upside down onto the powder for reconstitution. As this is a demo pack, there's no powder in. Allow the water transfer down, and on completion, screw off the top and gently encourage the reconstitution. Do not shake. It will take a number of minutes to reconstitute. However, will dissolve quickly at room temperature to a colourless and slightly opaque solution. If it fails to dissolve completely or has any cloudy deposits, do not use the preparation and contact Blood Bank for a reissuing. The total number of vials required to give the final dose can be reconstituted all at the same time. So at this stage, you'd reconstitute the second or third pack as required. Once it's reconstituted, it is ready for immediate infusion at a rate of 1 ml a minute initially, increasing to a maximum of 2 to 3 ml a minute thereafter. However, in the event of a life-threatening situation, an administration rate of 4 to 8 ml a minute can be used. This means that a dose of 3000 IU can be given over a total of 15 to 30 minutes. As a precautionary measure, the patient's pulse rate should be measured before and during the infusion. When reversing warfarin, a repeat coagulation screen must be taken 30 minutes after the completion of the infusion to assess if a further dose is required. If the INR has not corrected to less than 1.5, a further dose may be required. This must be discussed again with the consultant haematology team. A coagulation screen is not routinely required when reversing ribofloxacin or apixaban. Thank you.